You're listening to Winchester Radio with me, Anna O'Brien. And down the line, we are talking to Sara Paterson, who works as an Admiral nurse for Hampshire hospitals. Hello, Sarah.
Hi.
Now,
Hello.
Sarah, for anyone who is not aware who's listening in, an Admiral nurse is very much about supporting people living with dementia. But
Yeah.
explain a little bit about your role for our listeners.
So an Admiral nurse is a specialist dementia nurse. We are there for the whole family. So we support the family as well as the person living with dementia. It is led by Dementia UK, which is a charity for dementia. Our thing when people come into hospital is we more often give a lot of carer support to the wife, husband, son, daughter, neighbour, whoever's deemed an unpaid carer that supports that person day to day, and try and establish how we can better support them in the community and also whilst the person with dementia is with us in one of our hospitals.
And I know at Hampshire hospitals across all three sites, if you do have patients living with dementia, whether it's in Andover, Basingstoke, or in the wards at Winchester, the Trust supports John's campaign as well. So, again, for anyone who's not aware, that's an
Yeah.
important thing, isn't it?
Yeah, absolutely. John's campaign is open visiting for any family and carers of patients with dementia. And it was founded by a person called Nikki Gerard. Her father spent 5 weeks in hospital. He had Alzheimer's disease and he severely deteriorated. Um, she was obviously stuck to ward visiting times and felt that had she been able to go in further support, and there were times as well during his stay where she couldn't due to infection control purposes, so she couldn't actually go and support him at all. She just feels he wouldn't have become as deteriorated as he had, and eventually he ended up dying a lot sooner than anticipated. So she formulated this campaign and we as a trust support it. So it doesn't matter what ward they're on, from entry point at A&E to discharge, we have open visiting for our carers and families for people with dementia.
And of course, that's so key at particular times of the day. Specifically, I'm
Mm.
thinking such as meal times, because
Hmm.
people are in an unfamiliar surrounding when they come into the wards, and many
Yeah.
patients may well find that unsettling, but particularly for people living with dementia who really crave knowing their routine and seeing
Hmm.
warm, family, familiar faces, it can be really challenging if they have a sense of not knowing where they are or what's happening to them. And of course,
Yeah.
nutrition might well suffer as a result otherwise.
Yeah, it's one of the key things as well is supporting them with their needs and their day-to-day routine. And that's why we do heavily support families coming in to deal with that, because they will know the routine, they'll know their habits and the little nuances of their day. So they will know how to support and prompt them to enable them to have adequate nutrition and hydration, keeping them mobilized, giving them their personal care. So it is really important that they come in, especially around nutrition support. But obviously, if they can't come in, we do have things like the red tray for assistance with feeding, and we use our red cups if they struggle to independently drink without needing prompting. And hopefully, that visual prompt is there to aim them to drink more often and frequently to help maintain their hydration levels.
Yeah, which is really key, isn't it? Drinking well and
Yeah,
eating well, getting plenty of water, because obviously that can help with mobility as well, and avoid
yeah.
falls hopefully too.
Hmm.
And
Hmm.
I mean that's one of the things the trust has is also a team of dementia volunteers. And I know that Hampshire
Yeah,
hospitals for a number of years now have also had volunteers helping at meal times and assisting with those key times when you really do want to make sure somebody has eaten well and that the food hasn't been left and they're
yeah.
unaware and the tray gets taken away before they've eaten everything. So
Mm.
all of that really supports the trust and the patients, doesn't it?
Yep, definitely. We do have some volunteers. It's recently recently been relaunched. So they come into different wards at different times across the sites, And exactly as you were saying, and that it's just to help give a bit more support to the wards, supporting our patients living with dementia. And it is fantastic to see it back up and running. And it's a really positive move, I feel, for our patients as well as the staff and our unpaid carers and families for those patients.
Definitely. And something else to highlight at Hampshire hospitals, and I know other trusts have similar schemes, is that anyone who's coming onto the ward, there is that an awareness that a patient, without having to know all their medical history, but there's an awareness that somebody needs extra care, extra support because the trust operates the sunflower scheme.
Yeah. So we have the sunflower, which we have above the bed spaces, just to sort of notify those that are approaching the bed space to let that person have a bit of time to process questions and just be, just be aware that they
Yeah.
might not be able to understand or respond as timely as some other people may. And also we have it on our noting system so that when they come in, we're aware that there's already a diagnosis there, and so are other people as they move through the hospital. So it's just a nice symbol for us to know that they may need our support when they come in.
Yeah, definitely. And I know our team, when we're visiting, we're aware of that and using shorter sentences
Yeah.
and offering options,
Hmm.
and just making it a much easier conversation for somebody and having
Yeah.
that awareness of the Sunflower Scheme. And the Alzheimer's Society, I mean, obviously they have a number of initiatives that they run as well. And they have their booklet, don't they? This is me.
This is
And
me.
that's
Yeah.
very much about
Yeah.
encouraging people to relate to everyone as an individual and what somebody's
Yeah.
likes are and what's important to them.
Yeah, exactly. And it is really handy as well just to um, sort of understand that person a bit more personal. It's not in depth, but it just gives a little snapshot into, a little bit about their life, a bit about their routines, and how they're managing and things like that. And, even down to what they prefer to be called, which
Yes.
matters to them. And that's what we like to use to go by to help support them with their routine in hospital, because obviously it doesn't always quite fit with the ward's routines, but it lets us establish if there's something we may need to adjust to make sure that their needs are being met for them.
Yes,
So it is a
definitely.
really useful tool for us to have in place on our system.
So, for anyone who's listening, Sarah, who maybe has a loved one who's about to go
Mm.
into hospital, I mean, I guess they will also be anxious, the person living with dementia, but maybe extended family as well, about being away from their loved one. What sort of things could you say to reassure them or let them know about what happens if somebody's been admitted who's living with dementia? Because there will be patients with dementia on a number of the wards within the hospital.
The only thing I'd say, obviously, if it's a planned admission, is to maybe ask them to notify the dementia team. We can be contacted via email, or they can phone us either via switchboard or through our direct number, and just, sort of give us a heads up. Just so we know that we can put it in the calendar, we can come and check on them on the day and during their stay. I mean, we would normally do that even for the unplanned admissions. We review them within sort of 24 to 48 hours of them coming into hospital. Our team do aim to give that support to try and minimise any distress for the person with dementia whilst they're staying here. And we also like to liaise with the families and just check how things are. But obviously, if you're concerned, it's always best to try and make sure you bring in sort of their day clothes and their pajamas so that they're not stuck with pajama paralysis, in the sense of keeping their routine of getting dressed in the morning, wearing their own clothes, something that's familiar to them as well.
Yeah, and having that sense
Um,
of time then to work through the day with
yeah,
breakfast, lunch, and dinner, and when
yeah.
it's time for bed. Yeah.
Yeah, so it's just giving them those little cues throughout the day to try and keep them orientated as good as well as possible. And just maybe sending in pictures if they're going to be in a long time, just some stuff they can put around their bed space, and anything really that matters to them. So if they've got a specific cardigan that they like to wear, try and bring that in for them. If you know they like specific snacks, then definitely bring them in, because we do want to encourage their eating and drinking. Yeah, and just obviously visiting as and when you can, and letting us know if there's anything we can do as well to support them.
And you obviously, we started this interview talking about you being an Admiral nurse, which is a specialist dementia nurse. But I
Mm,
think also for anyone who's listening, I mean, clearly within the hospital there are clinical staff, but there is specialist training on dementia, and dementia awareness is also something that takes place with volunteers, isn't it? So there's everyone aware of what's the best way to care for a patient who's living with
yeah.
dementia. And I think that's really reassuring for families as well.
Yeah, yeah, definitely. We do try to be positive with our training and care provision that we give whilst people are here with dementia, because we understand it's not ideal for them to be in this kind of setting because it's out of their familiar environment and it's out of their routine. So yeah, we do try and keep up with keeping people informed and supporting them as well. So our patients are best supported alongside that.
And for people listening who maybe don't know a huge amount about dementia, I mean, people often think it's a natural part of the aging process, which of course it's not, although
No,
a lot of
yeah,
older people do have dementia. They may
yes.
have a loved one who's got confusion. It doesn't necessarily mean that is a
Mm.
dementia they have. I mean, it's really key that if somebody's concerned that they do go and see their GP, isn't it?
Definitely. That's the other side of things we do on admission. We try and establish a timeline of anyone that's coming with confusion over a certain age. I mean, the general rule of thumb is if there's more than a 6-month history, then definitely we would look to go down investigating the cognitive decline route of a potential impairment. But that's not to say you definitely have a dementia, because it can all be linked to having had infections or pain, and it can be something called a delirium, which in itself can take many months to resolve. So it's just trying to differentiate that when people come in, and recognizing that just because you're a bit forgetful doesn't necessarily mean that you've got a dementia. But it is key to get things sorted as quickly as possible via your GP in the community setting, because that's where they would do all the testing and, if needed, the diagnostic side of things. But again, if you're in hospital, we can recommend the beginning process of that, but we will often speak to the patient and their families with their permission to try and work out if there is a need for that to happen.
And sometimes some of the first symptoms that people may notice in themselves or in others that are close to them might be short-term memory loss or just
Yeah,
changes in behavior, that confusion, maybe
yeah.
communication struggling as well, and
Hmm.
finding the right word, all those things. But as you say, really
Yeah.
key to go to a GP and get a diagnosis, because if it is dementia, then you get the support you need, and
Hmm.
you're linked in with a lot of that support that is available into the community as well, which
Yeah,
helps.
definitely. Yeah, yeah, exactly.
So finally, Sarah, for anyone who's tuned in, who wants to find out more about how best to support a loved one, be it a family member, a friend, or a neighbour who perhaps has had a diagnosis of dementia recently, what could you advise? Where should they go to find out more to help them?
I would maybe speak to your GP to see if any have any links with any local community groups or services. I definitely would recommend contacting Andover Mind. You can do a self-referral to them.
Yeah, and of
They do
course they
support.
run the dementia advice support service, don't they, across the
Yeah,
county? So
yeah,
hugely helpful, and we'll
really
know a
keep
lot of
up.
other places they can signpost people to for
Yeah.
support.
And there's some websites as well that can help with sort of where do we go now, information and advice about the diagnosis. And even the memory team that will diagnose you should hopefully do some sort of follow-up and referrals for you to get some support post-diagnosis. And again, if you end up here with a new diagnosis, we are definitely more than happy to sort of signpost and support and help you through that initial stage of diagnosis, as well as your loved ones as well.
No, it's really good to know. And before we let you go, because obviously you very kindly are talking to us during a very busy week for you at Hampshire
Yes,
Hospitals, because it's Dementia Action Week. Just give our
it is.
listeners a flavour of some of the activities that you and your team are running across the trust this week.
So we're doing a bake sale to try and raise funds to purchase some equipment and supplies which will support those patients with sort of challenging behaviours or that are needed more enhanced care. We're doing trolley dashes around all the different wards with some quizzes, some snacks and prizes, and pens, because we know everyone loves a pen in a hospital. And we have made up some packs to give to our unpaid carers or families when they come in with our people with dementia during this week as a gift, just to say thank you, because we know it's very, very difficult and challenging at the best times without them having to be in hospital alongside that. And we are working with Andover Mind as well, who are, as I've said earlier, a great support system for community-based level with the carers and also the person with dementia. They're really great link to get tied into to get some signposting. Yeah, and just generally trying to spread the word on our Twitter account, through our comms team, and just talking to people as we pass by and just seeing how they are and if there's anything we can support with.
Brilliant. And if people do want to support you, I mean, there's a number of ways. I know we have the Hampshire Hospitals charity, which is
Mhm.
a great way to make donations because that supports so many parts of the trust and patient care and
Yeah,
supporting staff as well. And of course, you mentioned again about the volunteers. There are some specialist dementia trained volunteers who provide assistance on the wards. And I guess more people, if they have time, they
yeah,
could
that would be
offer their time
wonderful.
as volunteers, couldn't they?
Even just an hour here or there, it is definitely most welcome. We value it as well so much for our patients. So yeah, anything helps really. We do appreciate it.
Well, thank you so much for talking to us at
Thank you.
Winchester Radio. And it's so great that there is so much love and support within Hampshire hospitals because we're really blessed having such a caring and compassionate team
Thank
and
you.
knowing that our loved ones, when they are on the wards or they're in and out of appointments for clinics, that they are so well cared for.
Thank you very much.